The Advanced Care Center and Clinical Decision Unit is a new concept with Kaiser Permanente. It's a clinical area where people can come similar to an urgent care, but much more robust. Patients who are too sick to just be seen in a doctor's office, but not sick enough to need a full hospital stay of several days, can come here for observation, testing, medical treatments.
Jan came to us one afternoon with one complaint. We did a laboratory study and I noticed that there was glucose or sugar in one of the tests. That shouldn't have been there. It was a urine test.
I came to the ACC because I was having symptoms of a urinary tract infection. It was a Sunday afternoon and decided to come on into the care unit here.
I was able to ask her a few questions, and because of the electronic medical record, look through and see if she had had a history of diabetes. And looking through, I noticed that she did not have a history of diabetes. It had been some time since she saw her primary care doctor and had any kinds of laboratory studies done. And so after getting this information from the electronic medical record and from Jan herself, I was able to run additional tests, and we diagnosed her with a new onset of diabetes.
Dr. Hewling came in and went over the results with me of the urine culture and asked me if I had ever been diagnosed with diabetes. And of course I said no. I was shocked.
We did additional studies and were able to get her blood sugar better controlled before she left the department.
I didn't know that they had all the capabilities that they had. It was more or less like going to a hospital emergency room without all the hassle and waiting time.
Very few places, other hospital entities, healthcare settings offer an observation unit in the way that we do. Most of these other systems, they do have observation units. You go in through an ER, you're only seen by an ER doctor. Thankfully here at Kaiser, we kind of have a broader view of how we treat our patients and what we do for them. In that, you're not only seen by an ER doctor, but you have the opportunity to see an internist. So you're getting two specialties that are working on the problems that you're coming in for. Also, since you're a Kaiser patient, we're able to see everything that you've ever been at Kaiser for, what other issues need to be addressed, if there are other healthcare concerns that need to be looked at, evaluated. We work with your primary care doctors because we can see all of their notes. That's why the EMR is so important in what we do. Plus, because we're just focused on our members, you as a patient are not having to fight the masses when you're going to the ER and waiting there for 4 hours, 8 hours, whatever.
I was able to contact her physician, her primary care physician, through our electronic medical record and make her aware of this new diagnosis and that she needed close follow-up for it. By the Monday, her primary care physician was able to review the record, contact Jan, order additional studies, and we were able to get her into a healthy living class, which is a class that Kaiser offers here for a person with a new onset of diabetes or any other chronic illness to help them deal with that condition. Studies indicate that about 80% of patients that go to a hospital emergency department are discharged home without any further need to be in hospital. About 20% are admitted to the hospital, and of those 20%, more than half of those just need 1 day in the hospital. And that's the members the 85 to 90% of patients that we can serve in this type of facility. And so I think that this type of facility is needed. It drives down healthcare costs for both the member and for the institution, and it's a wonderful way to deliver care.
Kaiser Permanente is an awesome organization. They work as a team to not just diagnose you, but to care for you afterwards and to help you have a healthy life.